Okay, let's unpack this. We're diving deep into something that honestly feels a bit like science fiction, but it's very real. Virtual patient simulators.
Hmm.
And this really connects to what we've been talking about lately. How AI is shaking up medical education, moving beyond just cramming facts.
Right. And the sources we looked at, they really focus on how these simulators aren't just fancy gadgets. They're tools, powerful ones,
Tools for what, exactly?
for bridging that really critical gap between knowing the textbook stuff and actually, doing medicine, practicing it, but safely in a virtual space.
That gap, it's huge, isn't it? I mean, traditional training is obviously essential, but the sources definitely point out some big hurdles with getting enough real hands-on time.
Yeah, they do. They mention a few key things, like students feeling, frankly, pretty unprepared when they first interact with actual patients after years of books.
I can imagine.
And then that there are just practical limits, resources, maybe not enough sophisticated mannequins, or students only encounter common illnesses during their rotations. They miss out on the rare stuff, the complex cases.
Or sometimes that classic prep just doesn't quite get those day one practical skills down.
Exactly.
Okay, so this is where the virtual patient simulator comes in, and we're not just talking about, like, a slightly more advanced CPR dummy here.
Oh, not at all. No.
Oh.
The sources describe these as really sophisticated AI-driven programs. They genuinely mimic a human patient.
How so?
Well, think about it. They have vital signs that actually change in response to things. They have deep, detailed medical histories you need to uncover. They even show simulated emotional responses based on how you talk to them.
Wow.
The whole point is to drop students into these incredibly realistic clinical situations so they can practice every diagnosis, talking to patients, procedures, all within this controlled, safe environment.
That sounds incredibly complex to build. And the AI isn't just window dressing, it's central, right? This is where it gets really interesting. How does the AI actually make it feel so real?
Yeah, that's the core of it. They're using techniques like natural language processing, NLP. That's what helps the system understand the student's questions, when they're interviewing the virtual patient.
Okay.
And machine learning, ML, is used to create these virtual patients who have dynamic symptoms, varied backgrounds, personalities. They react dynamically, kind of like a real person would.
So the AI isn't just running a preset script.
Not at all. It's making decisions based on the student's actions and questions. It adapts.
So there are actual consequences inside the simulation. It's not just like, press A for the right answer.
Exactly. The sources give a great example. Say a student orders the wrong medication based on their assessment. Well, the virtual patient's condition could actually deteriorate realistically.
Oof, that's a powerful lesson.
A very powerful lesson you definitely can't teach safely with a real patient. But conversely, if the student asks the right questions, the insightful ones, the AI gives them the crucial information they need to move towards the correct diagnosis.
And it tells them how they're doing.
Constantly. A key part is the feedback. The AI explains why something happened, or maybe why their approach wasn't optimal. It highlights specific areas they need to work on, often right in the moment.
Could you sort of paint a picture for us? What's it like for a student using one of these?
Sure. Imagine you're a med student. You log onto a platform, maybe just on your laptop. You pick a case, let's say someone presenting with sharp chest pain.
Okay.
The simulator immediately provides a detailed history. Maybe they smoke, have a family history, recent travel, plus initial exam findings. Then it's your turn.
You take charge.
Right. You start interviewing the virtual patient. Tell me about the pain. Where does it go? You ask follow-ups, order virtual tests, maybe an EKG, blood work. And based on all that data coming back, you formulate a diagnosis and suggest a treatment. You're basically running the whole encounter.
But without the real-world pressure.
Exactly. Safely.
And the AI is sort of looking over your shoulder the whole time, evaluating.
Precisely. As you work through the case, it's giving you feedback. On your clinical reasoning, did you connect the dots correctly? On your communication, were you clear, empathetic? And of course, on the accuracy of your diagnosis and plan.
What if you miss something?
It might point it out. It might suggest other conditions you should have considered. That's practicing differential diagnosis, thinking through all the possibilities. Or it might flag errors in how you ordered tests or interpreted results. It lets students really hone those complex skills through repetition.
The advantages you're describing, the ones highlighted in the sources, sound pretty significant. What are the main ones they emphasize?
Well, the big one, as we've said, is safety. It's a learning environment where mistakes are okay. They're learning opportunities, not catastrophes. That's huge in medicine.
Can't overstate that.
Second is the sheer diversity of cases. In limited clinical rotations, you see what you see. Simulators can give students instant access to hundreds, even thousands, of different scenarios, common stuff, super rare diseases, unusual presentations. That breadth is invaluable.
Especially for things you might only see once in a career, if that.
Absolutely. Third, that personalized feedback we talked about. It's not just a grade, it's specific analysis of your performance, pointing out your strengths and weaknesses.
Tailored learning.
Exactly. And finally, maybe the most important for the student experience, confidence. Practicing these intense interactions, these tricky procedures, in a low-stakes setting. It massively reduces anxiety for when they face the real deal.
Yeah, that confidence piece really strikes a chord. And the sources had that anecdote, didn't they? The one that really illustrates this.
Yes, the story about Dr. Amit, a neurology resident. He talked about being absolutely terrified before his first real lumbar puncture. Inserting a needle into the spinal canal. It needs real precision.
I can only imagine.
But he said he practiced it on a virtual simulator dozens of times. And while the fear wasn't gone entirely, he felt much more confident and prepared when it came time to do it on an actual patient.
What specifically did he say helped?
He mentioned it helped him really master the technique, the feel of it, and also anticipate things that could go wrong, potential complications.
Yeah.
Just shows the practical, almost psychological benefit.
It's such a clear example of the real-world impact, and it underlines that important point. These aren't about replacing human teachers or real patient experience. That's still essential.
Absolutely not. They're powerful tools to augment learning, to enhance human skills. They make the whole process more personal, more efficient, maybe even more empowering for the student.
Helping them be better prepared, more skilled, more confident when they finally do step into that real patient's room.
That's the goal.
So wrapping up this deep dive, the core message seems clear. These virtual patient simulators, driven by AI, are giving future doctors, nurses, and other healthcare pros a really valuable chance to practice critical skills safely.
Right. They replicate complex situations, give that tailored feedback, and really help bridge that gap between the classroom and the clinic.
Equipping them with confidence, competence, making them ready.
And that ability to practice something like a lumbar puncture over and over like Dr. Amit did, or to work through tricky diagnoses without risk, it means they start their hands-on training less anxious and, frankly, more capable.
Which ultimately points towards what really matters. Better patient care, better outcomes, a stronger healthcare system overall.
It supports that whole journey, from being a student just starting out to becoming a skilled clinician ready to make a difference.
So here's a final thought for you, the listener, to mull over. How does this kind of targeted, repeatable practice where you can see the consequences of your decisions safely, how does that fundamentally change what it even means to be trained in medicine? It seems to shift the focus even more towards getting those practical skills and critical decision-making abilities down before you're dealing with real patients. What could that mean down the line for things like medical residencies or even how experienced doctors keep their skills sharp?
Yeah, it's a fascinating potential shift in medical training to think about.